I'm Dr. Walt Lowe from University of Texas in Houston. Today we're going to talk about a GraftNet case presentation. Quick history, this is a middle-aged, very active guy who tore his ACL doing jiu-jitsu, had the classic presentation, only change was actually an unusual lateral ramp. Just a little background so you can see the concept behind using this tissue. It's documented in our literature that there are resident human cells from the ACL that can be collected from the ACL stump. And so with this work becoming more mainstream, it's let some ideas flow to use the autogenous tissue from the ACL to augment healing of our grafts for ACL reconstruction. So this case is a quad tendon reconstruction of the ACL done with typical graft preparation, fiber tag techniques, and then utilizing the GraftNet to collect cells from the ACL stump, both on the tibial and the femoral side. And then finally, I'll show how to prepare this ACL tissue collected by the GraftNet and then inject it into this quad tendon graft, hopefully to implant cells, helping this tendon graft convert to ligamentous tissue. You have to have the GraftNet attached to your shaver and then harvest the ACL stump only with this tissue to ensure we get the cells we want to get to reimplant. And then I'll show you some video of how we prepare that. So you can see the tissue that we get here. It's sort of this thick globular tissue that we then have to convert into an injectable form to use it in the graft. And so that's done using this female-to-female Luer adapter where this tissue is moved back and forth between two 1 cc syringes to homogenize this collected tissue into an injectable form. This is a little laborious as it has to be 30 or 40 of these passes between these two syringes to get the tissue into a consistency that can be injected through an 18 gauge needle. So the graft is then put in a graft tube so that we have a way to inject this tissue into it without expanding the graft. So it takes up little soft tissue spaces within the graft. And then we inject the prepared stump tissue from the ACL with just an 18 gauge 1.5 needle, as this video shows, through either end of the graft as deeply as we can put the needle into the graft tissue. So in closing, the GraftNet device has allowed us to harvest native tissue, both soft tissues from the ACL, and lets us harvest bone after drilling tunnels that can be used for bone grafting of the patellar and tibial tubercle defects after patellar tendon reconstruction. So GraftNet has really increased our ability to add to healing structures that are involved in the reconstructions of our ACL patients. Thank you.